Good afternoon, everyone. Doug Dunbar and the CBS 11 News team. In a special report, we interrupt your afternoon for a little bit because Governor Greg Abbott is about to give us an update on the coronavirus situation here in the state of Texas on this day, a Monday, where we get new numbers from Dallas County. 454 new cases since this time yesterday. Half the new cases in Dallas County specifically since June 1st have been among young adults.
We're here today to discuss the recent increase in the number of COVID-19 cases in Texas, as well as to discuss the ways that Texans can and frankly need to step up and work collaboratively to make sure that we respond to this increase. Now, from the beginning of our response to COVID-19, I have repeated several guidelines. First, decisions about how to respond to COVID-19 will be based upon data as well as advice from doctors. Second, COVID-19 remains a very fast-spreading virus that will remain in Texas, the United States, and across the entire world until treatments are available to mitigate it. As a result, we must find ways to return to our daily routines while also learning ways to coexist with COVID-19. Third, our early goal was to slow the spread of the coronavirus to prevent our hospitals from becoming overrun. We succeeded in that early goal by following the best practices to make sure that we did slow the spread. And as a result, we did prevent our hospitals from getting overrun. And as we gather today, hospitals continue to have abundant capacity to treat patients with COVID-19. Fourth, as we opened up from stay-at-home policies, we established safety protocols to minimize the increase of the spread of COVID-19. These protocols, which are contained in this booklet right here, they provide guidance for all Texans and all Texas businesses. If these guidelines are followed, they help to reduce the spread of COVID-19. The protocols have several core principles. If you are at risk or if you're sick, you should stay at home. You should frequently sanitize your hands. You should maintain safe distances from others when you do go out. And when you do go out, you should wear a face covering or a face mask. These strategies have proven to be effective in stopping the spread of COVID-19. Fifth, I've said all along that if the positivity rate or the hospitalization rate increase too much, we have strategies to reduce the spread of COVID-19 without having to return to stay-at-home policies. Sixth, closing down Texas again will always be the last option. Now, with that context, I want to review several key data points. They are shown in three graphs that I'm providing today. First is a graph showing the daily number of people testing positive. In the last half of May, Texas averaged about 1,500 positive cases a day. In the past 5 days in June, we've averaged more than 3,500 cases a day. Second is a graph showing the rise in the positivity rate. The positivity rate has gone from about 4.5% in late May to almost 9% today. Last is a graph showing the rise in hospitalizations. Hospitalizations for COVID-19 averaged just over 1,600 a day in the latter part of May. In the last 4 or 5 days, hospitalizations have averaged more than 3,200 a day. To state the obvious, COVID-19 is now spreading at an unacceptable rate in Texas, and it must be corralled.